nurses, whether it's our PSWs, whether it's our maintenance staff, whether it's our diagnostic folks, they are stretched to the limit. The last time I was in the emergency of Hotel Dieu Hospital, I talked to the nurse, young nurse that just started there about a year, and I asked her how she was doing. And she was on her 16th hour in the emergency of the hospital. And I said to her, I thank you for your commitment. I thank you for your dedication. But from my perspective, I want a nurse that starts the first hour and leaves after 8, and a fresh nurse comes in after 8 hours to do the work. There's way too much pressure on our nursing professionals to stay, and you know why they stay? Because they're committed, because they're dedicated. Walk through a long-term care facility like I do most days, and ask yourself whether you have the determination to protect the interest of those that need government support. Don't do it from the legislature. Take your cabinet to the people. Take your cabinet to the poor. Take your cabinet to the disabled. Take your cabinet to those seeking long-term care support, and work on behalf of the people instead of the interest of those that don't need financial support. Brothers and sisters, fight like hell. You're making a difference, and I'm a proud advocate to join with you and challenge for it. Enough is enough. Let's hear it. Enough is enough. Enough is enough. Enough is enough. Protect patients. Protect patients. Protect patients. Thank you, brothers and sisters. And now
I called the PC government liars in one of my statements, and I was called out on it as being unparliamentary. So, I'm unparliamentary by calling the government a liar. But this is a government prior to the election that said to families with autism, children with autism, that he's 1,000% behind those families, and that you would never have to be on the lawn of Queen's Park if I become premier. So I'm unparliamentary for calling the PCs a liar. What's it like to be the liar? Isn't that a little unparliamentary at the end of the day? It's like being a lying piece of garbage. As I said, folks, how many of you have actually, and to my point about Rick Nichols, how many of you lobbied or actually
That's why we don't want to see the amalgamations. And it's not just in Ontario where the amalgamations were proven to cost more than they would ever save. In fact, there were no savings at all. In fact, the major health research branch of the federal government has concluded in its major study of hospital and healthcare mergers from the 1990s and early 2000s across Canada that there is no evidence whatsoever that they provided savings. And they say in their kind of academic language, it's peculiar that governments still pursue these ideas of amalgamations and mergers, and the onus should be on those people proposing the amalgamations and mergers to prove that they are going to find savings, because that is not what has happened to date across the country. And they go on to say that in fact there have been serious service issues that have been raised as a consequence of merging and amalgamating services. Alberta, over the last decade, tried to centralize their ambulance dispatch services, and as a result, there has been devastating loss of service in local communities. In fact, 29 local municipalities wrote an open letter to the provincial premier advocating that the centralization be reversed and the services decentralized and moved back to the local communities. We fund our health care overall at the lowest rate in Canada. This is by the government's own figures. In fact, we fund all our public services in Ontario at the lowest rate in Canada. That means more user fees. That means longer wait times. It means overcrowded hospitals. It means that we have the fewest long-term care beds of any province in the country, the fewest nurses per patient in the country. It means that we're suffering from a lack of services, and people have to pay increasingly thousands of dollars out of pocket for health care when they're sick, when they're elderly, when they're in need, and when they're least able to pay. In Canada, we built a public healthcare system to stop this. We built a system that said that healthcare would be based on need, not how rich you were. That healthcare would be provided to everyone as a right of citizenship because we believe in taking care of each other. We pay for the healthcare system through our taxes so that the care will be there when we need it. We don't pay so that corporations then get tax cuts out the other door and our care gets cut when we need it. We need a public health care system to be there for us. That means our government has to plan to meet the needs of our communities. We are at the end of the cuts that we can tolerate in this province. Your hospitals all across the Southwest have suffered draconian cuts. They're about half the size they were before the amalgamations started. And there's far too few services here for everyone. If we can say one thing to Monty McNaughton and Bob Bailey and Rick Nichols and our local MPPs, it's this. We need you to do what you promised to do in the election, what Doug Ford promised to do. We're nonpartisan in the Health Coalition. We don't tell people how to vote, we just tell you the truth and we try and save our services. And what Doug Ford promised to do was to end hallway medicine, improve mental health care, and improve access to long-term care. That's what we need them to do. They have no mandate for these cuts. So let's send the message strong and clear. Let's stop those cuts. Thank you very, very much.
We sent people to the United Nations. We saw it on the news media that people could make presentations on childcare. We went to the United Nations. The other thing is we went to Parliament Hill because our health care was going to be cut by the federal government. We made teeth in sponge and we put on a skit on Parliament Hill with 3,000 of our people there. So you can do a lot of things, folks. I wouldn't put it past you to put a bed on Queen's Park next to a toilet, because I heard that today. I mean, you would show people in Ontario how bad our health care is. We also went on the news media. We had piped in to Wawate, which is in the northern radio station. We piped it in from London and also to Akwesasne, and we let people know the problems that we had. So use your imagination. I mean, you can pull a good rally at Sarnia or Chatham or wherever. So I encourage you to do that. Thank you.
We need you. And now a word or two from Nicole Granger, who's the co-chair at Chatham.
Hello, everybody. Nicole Granger, I'm president of Local 127. Proud that Unifor is the largest private sector unit in Canada. We represent the biggest sector we have is healthcare. I've elected out of healthcare, so I'd like to talk to you through the eyes of being a mother, a grandmother, and a healthcare worker. We respect the work that the healthcare workers do every single day because it's second to none. We know that the elderly and mentally challenged are the most vulnerable people in our community, and they deserve to be cared for with dignity and respect. Our members are working harder, they're working short, they're working a large workload, and their injury rates are skyrocketing. We hear from them daily. These members talk about the mental stress they are under, and all the healthcare community workers didn't take this job for the money. They're not asking for raises, they're asking for help and hands on the floor. They took it because they care about people. If you have a loved one in the hospital, or in the nursing home, or in the community home, and you feel that they're not getting the care they need, you're right, they're not. That's exactly how our healthcare workers feel. So let's not blame the caregivers, let's blame where the blame deserves to go, to bad government policies and bad governance. And if it's not bad enough already, the workers are going in knowing that they cannot provide the essential satisfying needs. But if Doug Ford has his way, it's not going to get better, it's going to get worse. I'd like to speak to you also for a moment through the lens of a first responder, as Unifor represents a lot of first responders. Most of us have heard a story about someone having a heart attack or a stroke in our community that made it to the hospital just in time, or the first responders were there so quickly that they were saved. But if they made it just in time this year, next year that story's not going to end the same way. More people are going to die from these cuts, folks. It's so important. So finally, these first responders that have been trained to save lives, there's going to be 2 calls come in after the cuts, and there's only 1 ambulance. They're going to have to choose not who to save, but who has to die. I just thank you. So behalf on the elderly and the sick and the most vulnerable, and behalf on the caregivers that care for them every day, on behalf of the family members that have a person in those situations, please help us help you and stop Doug Ford. Thank you so much.
It's now or never, I'm holding tight. Kiss me, my darling, be mine tonight. Tomorrow will be today. It's now or never, my love won't wait. It's now or never, my love won't wait.